Cancel HIV is sponsored by the Prince George's County Health Department.
Today is February 7th, which is National HIV/AIDS Awareness Day. This observance is a day to acknowledge how HIV disproportionately affects African Americans. I spoke to Diane Young, who is the Associate Director of the Family Health Services Division at the Prince George's County Health Department, who explains the importance of sexual health awareness. Diane, it's great to see you again. Let's first talk about the significance of National Black HIV AIDS Awareness Day. What is that day all about?
Sure. The National Black HIV/AIDS Awareness Day was a grassroots education effort. Now it's a national observance day dedicated to raising awareness about the disproportionate impact of HIV on African Americans and Black Americans in the United States, and the importance of increasing access to HIV prevention, testing, treatment, and care for reducing this burden in our community.
Okay, have you seen an impact of the increased sexual health awareness in the county? Has there been a difference that you're seeing being made?
Well, there actually is, because what we know is sexual health is fundamental to the overall health and well-being in our community, for individuals, for couples, and for families, and for the economic and social development within our community. We're helping our clients to affirm positive and respectful approaches to their sexuality and sexual relationships, which is always great for their mental health, as well as the possibility of having pleasurable relationships and not being afraid to have safe sexual experiences that are free of coercion, discrimination, and violence.
How have you seen AIDS, HIV impacting specifically the Black communities in Prince George's County?
Well, unfortunately, HIV and AIDS has always disproportionately impacted the Black and African American community. So when compared to other races, including Black Americans that live in Prince George's County, they have a high burden of HIV infection. And research shows that structural racism, implicit bias, systemic racism, inequities in the social determinants of health drive these disparities in the HIV burden. And when we talk about the social determinants of health, we're really referencing where people live, where they play, where they work, where they worship, and where they age in place.
I know that Prince George's County is always working to reduce HIV infections. How are you doing that now? What's the current effort?
Our current effort includes offering educational series, workshops, town halls, and by using our local HIV advisory group to drive our activities around ending the HIV epidemic. What we have done is ensured that every county resident can know their HIV status through free HIV testing throughout the county. We offer it in our clinics, through our community partners. We also target our primary care providers to help them normalize routine HIV testing. We also offer PrEP, which is 1 pill a day or 1 monthly injection for those who are HIV negative to prevent HIV transmission. We offer that in our clinic as well as with our community partners. We also offer treatment in our clinic through our community partners. And for those who are living with HIV, we want to ensure that they are vitally suppressed so that they do not suffer an AIDS-defining illness and do not transmit the virus to their sexual partner.
Well, we know that you are always doing so much to help out the community and fight the HIV/AIDS epidemic. So thank you for being here and updating us. Great to see you, Diane.
Thank you so much, Ellen. It's great to see you as well.
And for more information about HIV testing and treatments, call 301-583-3150, or you can visit the website, which is health.mypgc.us/ending HIV.